guys, this is the NCLEX-RN ATI Comprehensive Review Series. This is section 6F, in which we're going to be talking about hematological disorders. Anemia. Anemia is a deficiency of red blood cell count, or hemoglobin and hematocrit. Anemia causes decreased oxygen to get to the cells, which could cause someone to be hypoxic. Causes of anemia: blood loss, greater than normal destruction of our blood cell count like a spleen disease, abnormal bone marrow function like with chemo, decreased erythropoietin like with renal failure, cancer, nutrition deficiencies like iron, B12, folic acid, intrinsic factor, etc. Signs and symptoms of anemia. So these are general: fatigue, weakness, dizziness, headache, pallor, tachycardia, decreased hemoglobin, hematocrit, and red blood cell count, shortness of breath, dyspnea, decreased oxygen levels. Interventions. So you want to monitor the labs like the hemoglobin, hematocrit, red blood cell count. You want to monitor the skin. You want to give oxygen, blood, and medication, and foods high in iron like meat, chicken, fish, etc. Now we go on to types of anemia. Iron deficiency anemia. So what is it? So it's from low levels of iron, which causes anemia. Symptoms: it's going to be very small red blood cells, weakness, they're going to be pallor, etc. Some causes are chronic blood loss, nutritional deficiencies like they don't have enough iron. If they're an infant, older adult, or younger adult woman, they're at risk. So like a younger adult woman because they have their periods and they lose blood from that, etc. Treatment: you want to monitor for bleeding symptoms and give them iron. Next we go on to vitamin B12 deficiency anemia. So this is a lack of vitamin B12. So symptoms are going to be numbness, tingling, hypoxemia, pallor, jaundice, and poor balance. Causes. So causes are too little HCl, so basically too little acid produced by the stomach, or a gastrectomy or malnutrition. So something has to do with the stomach not having enough acid because vitamin B12 is absorbed there. So treatment is going to be labs, rest, balanced diet, intake, and medication. So next we go on to folic acid deficiency anemia. So this is a deficiency from folic acid which causes anemia. Symptoms are going to be the same as B12 deficiency anemia. So causes are poor nutrition, malabsorption like Crohn's disease, and drugs like alcohol. Treatment: you want to give them folic acid. So with all these deficiencies that we said so far, it's basically a lack of either iron, B12, and folic acid. They're going to have pretty much the same symptoms, and the causes are usually from not taking it enough or it not being absorbed, and the treatment you want to give whatever you're missing. So you want to give iron, B12, folic acid, etc. Now we go into sickle cell anemia and aplastic anemia. So sickle cell anemia, this is a genetic deficiency where hemoglobin assumes a sickle shape and gets less oxygen to the tissues. So the sickle cell is a weird shape and it gets stuck in the blood vessels, causing occlusion, which is like a crisis. Symptoms: severe pain, that's going to be your main symptom, swelling, fever, jaundice, susceptibility to infection, hypoxic, damage to organs. Causes of the crisis, which I say like the sickling when it comes stuck. So stress, dehydration, hypoxia, high altitudes, infection, and you're at risk if you're African American or Mediterranean. Treatment. So treatment's going to be to get adequate hydration. IV fluids are very important. O2 therapy, you want them to rest, avoid high altitudes, avoid alcohol and temperature extremities. You want to identify the triggers and give medication, especially like morphine to manage pain. Now we go on to aplastic anemia. So this is that the bone marrow is damaged. The bone marrow has red blood cells, white blood cells, and platelets. So you're going to have a deficiency in all three, not only red blood cells. Symptom. So from a deficiency of the red blood cell, you're going to have hypoxia, pallor, and fatigue. From a deficiency of the white blood cell count, you're going to be susceptible to infection. And from a deficiency of the platelets, you're going to have hemorrhage and petechiae. Causes are medication, toxin, virus, and radiation. The treatment: you want to monitor the labs, you want to put them in isolation because they're susceptible for infection, you want to monitor for infection, emotional support, they might need a bone marrow biopsy, and medication. Here are the last two anemias that are not really tested. So anemia secondary to renal disease. So this is just from a lack of erythropoietin, and the treatment is going to be give erythropoietin. Thalassemia. So this is an inherited blood disorder that causes the body to make an abnormal form of hemoglobin. It causes destruction of the red blood cell, leading to anemia. Symptoms. So in the first few years of life, they're going to have bone deformity in face, fatigue, growth failure, shortness of breath, and jaundice. The person gets the inherited gene from both parents. Risk factor: Asian, Mediterranean, or African, or family history. Treatment: you want to encourage intake of folic acid. They're probably going to have regular blood transfusions, rest, genetic counseling, chelation therapy, which removes excess iron from body, and bone marrow transplant. Thank you for watching. Stay tuned for part 6E, in which we go over the cardiovascular diseases. Please subscribe and like.